Hi, welcome to Lecture 3, Scarcity, Opportunity Cost, and Efficiency. Today I shall share the key concepts in health economics that shape every healthcare decision. What is scarcity? As covered earlier, scarcity means that resources are limited, but needs are unlimited. What this means is that there's a lot of things that we want to do, but you can't do. Even if you have the most, even if you have all the money in the world, you may not be able to recruit all the nurses and doctors for your hospital or country. So this is something that we have to think of. It applies not just to money, it applies to the staff. There's also time needed to train the doctors, the nurses, and allied health. Time, of course. Hospital beds. It takes time to build hospital beds. This is why during COVID-19, many hospitals, many countries face a shortage in beds, especially ICU, because they were not meant to contain, to manage such a large number of patients. Vaccines, for example, in the earlier part of COVID-19, vaccines were in shortage, so priority needs to be given to those that need it. Scarcity forces us to make choices and prioritize. So as mentioned, ICU beds in during COVID-19, this is in shortage, so doctors have to make a tough decision on who to admit and who not to. When the hospitals are overwhelmed, they also need to decide who can be managed at home and who needs to be seen at the hospital. There are limited slots for specialist referrals, so all around the world, there may be a waiting time to see a doctor, a specialist. Even for a GP, there are some settings that you need to make an appointment to see a general practitioner, a family doctor. You can't even walk in to see them. So these are some of the scarcity in terms of the limited supply. Budget constraint for new drug funding. So this is an interesting part because for a lot of drugs requires the pharma industry to pump in the money for research and development. This is why a lot of times we can't really have enough money to fund all the new drugs. These are some of the budget constraints for the country, even if there is, especially for rare diseases. For rare diseases, it's even tough for pharma company to make an economic case to develop new drugs. What is opportunity cost? The value of the best alternative that is foregone. This sounds a bit difficult to understand, but let's give you a joke. For example, there was a boy who told his father, "Today I missed the bus, that's why I walk home, and I saved $2." The father was very upset and said, "Why didn't you consider taking a taxi? Then you could have saved $20." Okay, this meant as a joke. But what opportunity cost refers to is the next best availability or things that you're usually going to do. So for example, in this case, if you walk home instead of taking a bus, you save $2. Do not use the extreme example of having a private jet sending you from your school to home. If that's the case, then you could have saved $1 million by walking home, which is not the way. So what we always do is we look at the best alternative that is foregone. Every choice in healthcare means giving something up. So if you train a doctor, then you will have less of a talent to become a lawyer, to become a entrepreneur, to become a administrator, things like that. So every choice in healthcare means giving something else up. So in Singapore, we have this idea of not wanting all our top students to do medicine and law. So we want to reserve some of our top students to do other fields where they are needed. So every choice in healthcare means giving something else up. It's not just about money. It includes time, attention, personnel. So this is something that you need to think of when you talk about opportunity cost. For example, instead of listening to my lecture, you could have spent the time to listen to music, to go out with your loved ones, but you actually spend the time with me. So I'm very grateful for you spending the limited resources, which is time. Opportunity cost in practice. So you can choose to build a dialysis center versus to build a stroke rehab unit. You can't build both. So what is important? You cannot always base on demand because it may not be fair. For example, dialysis center is important, but so is a stroke rehab unit. So these are some things that we need to trade off. So we come up with certain criteria which we'll cover in the next few lectures on how do you consider since all the different diseases have different outcomes and different costs. Treating one patient means delaying treatment for another. That's another important thing. So the doctors can only see a patient at a time. That means brings me the idea of having a group therapy. Okay, that's a different question. But if you treat one patient, means you delay treatment for another. And of course, investing in prevention may reduce future acute care, but it deprives the use of the money for acute care right now. What is efficiency? So it simply means using resources to get the maximum health benefit. There are two types of efficiency that we shall cover. One is technical efficiency. So for a given output, what is the least cost? So once you decide what to do, how do you do it best? Second thing is allocating efficiency. This refers to directing resources to where they create the most value. So this is very important because you may be doing something to the best ability, but you may be doing the wrong thing. So in life, just like health economics, you need to decide what you need to do. After deciding what you need to do, then you must decide how to do it in a much more efficient, much more cost-effective manner. Efficiency versus equity. I gave an example earlier. Efficiency means to maximize outcome for the cost, and equity means fair distribution even if not most efficient. So previously I gave an example of vaccination. So the most efficient way is probably for patients to come to a central system to actually have the vaccination instead of the doctors, the nurses going to the patient. But by doing so, it may not be fair to those who can't travel to the vaccination center. So this is something they will take note of. Trade-off exists, and that's why health economics help to navigate them. Are you focusing on efficiency or are you focusing on fairness? In a summary, these are some of the things that I hope you can take home with. Scarcity forces us to make choices. Sometimes these choices are difficult choices. Opportunity cost made the trade-off explicit because you need to consider the next best alternative. Efficiency is about maximizing impact. You want to do the best, but make sure you're doing the right thing. Okay, so think, how do this apply in your clinical or policy work? Some food for thoughts. Thank you for listening.